Meet Chris Henry. In his school years, he was a wrestler, a football player. Now he's a nurse and a new father.
Oh, it's my baby boy.
In the spring of 2004, he was helping to transfer a patient from a stretcher to a table.
On three. 1, 2.
We went a little too far, and the patient's weight came entirely on me. We kind of went down in a slow, controlled movement. The patient was fine. Unfortunately, I was not. The pain was crippling. I never felt back pain like that in my life. It's as if someone stuck a knife right in the middle of your back and you can't move. It was paralyzing.
An MRI showed Chris had herniated a disc in his lower back. As a result, the shock-absorbing discs between the vertebrae in that part of his back were bulging out, pushing against his spinal cord and causing intense pain. Chris had to stop working for a time.
I was very depressed. I felt useless. And for someone like myself, not being able to provide for my family was devastating for me.
If this had happened just 2 years ago, Chris would have needed major back surgery, a spinal fusion, cutting through muscle and ligaments and bone, with months of recovery and rehabilitation. But now, Temple doctors could offer him a minimally invasive procedure called a discectomy, done with a small needle.
A tiny needle goes into the disc under X-ray guidance. We put the small needle into the disc, then remove some substance of the disc under X-ray guidance. This is done as an outpatient procedure. Patients literally walk out from our procedure.
I was a little skeptical. And I couldn't see how this tiny little needle is going to help me.
But he was desperate. So in March 2004, his discectomy began.